Hello friends, welcome to NEET PG Live Daily. Myself Dr. Apoorva Mittal and I am your educator for anesthesia on this prestigious platform for Unacademy. So let's start our today's topic, that is rapid revision in anesthesia for the FMGE exams. As the FMGE exam is 2 days after, so I'll just be highlighting very important points that you must know just before the exams. I have covered all the topics in everything, but I'll be just talking about very important points that you need to revise in anesthesia before the FMGE exams. Okay, so let's start our today's topic, but before that let me give you introduction to Unacademy Plus. So in Unacademy Plus, by getting the subscription, all of you will be able to avail the live classes for all the 19 subjects and also interact with the educator. The advantage of the plus subscription is you have the integrated courses. Like, for example, if you are planning for NEET 2021, there will be a separate course for that in which all the 19 subjects will be covered and all the topics will be covered, and also we'll be having test series and analysis through which you can evaluate your progress and also come to know how the questions are asked, and live doubt clearing sessions in which you can clear the doubt pertaining to the subject. So the advantage is like, especially nowadays in the corona times, sitting at home, you are getting the environment of a live class in which you can ask a doubt to the top educators. You can attend the live classes and all the 19 subjects will be covered thoroughly, which will be beneficial for you to crack the NEET exams. Okay, so these are the advantages of getting the Unacademy Plus subscription. Now the Unacademy Plus subscription, okay, that is for either a 1 year or a 2 year course. Okay, and if it's for a 1 year, then the price is 24,750. For 2 years it is 36,000. And if you apply my referral code, okay, the referral code here is Apoorva Live. Apoorva Live. If you apply my referral code Apoorva Live, you will get 10% discount on the above prices. Okay, so let's start our today's topic, that is rapid anesthesia revision. We'll quickly go through the topics. In today's class, I'll be discussing about the history of anesthesia, the important questions that can be asked from the history point of view, the pre-anesthetic checkup, which is a very important topic from all the exams. Okay, the anesthesia machine per se, and the breathing circuits. Okay, so these topics will be covered in today's sessions. So coming to the history, I hope I'm audible and clear. At any moment, any doubts, please let me know. Okay, the history. So basically, coming to the history, what does anesthesia literally means? It means no senses. And this anesthesia word, okay, the anesthesia word was coined by O.W. Holmes. So remember the history, it was coined by O.W. Holmes. The word anesthesia was coined by O.W. Holmes. Now, if you come to the word balanced anesthesia, first of all, what is balanced anesthesia? In balanced anesthesia, all the components pertaining to the anesthesia are covered. That is, there should be loss of consciousness, analgesia, the patient should not have any pain, amnesia, loss of reflexes, and muscle relaxation. Okay, I'm sorry, my image is coming in front. Just 1 second. Okay, so balanced anesthesia is the loss of consciousness, the analgesia, amnesia, loss of reflexes, and muscle relaxation. Okay, so all the 5 components which should be covered in anesthesia, if they are covered, then it is balanced anesthesia, and it was introduced by Lundy and Waters. The other thing that was introduced by Lundy and Waters was thiopentone. So remember, Lundy and Waters, the term balanced anesthesia and thiopentone. Okay, now Ether, why is it important? Ether was the first anesthetic agent. Okay, the ether, it is the oldest, okay, it is the oldest anesthetic agent, and the first demonstration, the first public demonstration of ether was done by W.T.G. Morton. So remember the word anesthesia, OW, Holmes, balanced anesthesia by only and water. But the first public demonstration of ether was done by W.T.G. Morton. And one more thing I wanted to tell, but father of anesthesia, okay, father of anesthesia is John Snow, remember please. Okay, the father of anesthesia is John Snow. So W.T.G. Morton, first public demonstration of ether, and that was done on, remember, 16th October. Remember this date. It was done on 16th October 1846, and therefore it is celebrated as World Anesthesia Day. Okay, it is celebrated as World Anesthesia Day. Is it clear? Is it clear? Any doubts till now? So ether, the first public demonstration by W.T.G. Morton on 16th October 1846. And ether, if I'll talk about ether, it is a complete anesthetic agent. That means it produces analgesia, amnesia, loss of consciousness, loss of reflexes, and relaxant. So it is a complete anesthetic agent. But nowadays, why we are not using it, that is important, because it is not used. Being a complete anesthetic agent, it is not used because it is highly inflammable and explosive. Also, ether, it is emetogenic. Okay, ether, it is emetogenic, but the BP and the respiration is well maintained with ether, and it does not sensitize the heart to adrenaline. So the only problem with ether was it was highly inflammable and explosive, therefore it is not used. Also in diabetic patient, it caused hyperglycemia, therefore it is contraindicated in diabetes patient. So these are the points which you should remember about ether. Okay, the first public demonstration of ether was done in Ether Dome by W.T.G. Morton on 16th October. Remember 16th October. Now, the ether was given by open drop method. This can be asked as an image-based question. This mask is known as Schimmelbusch mask. So please remember this. This mask is known as Schimmelbusch mask, which can be asked as an image-based question. Okay, and ether anesthesia. Is it clear? Now, another important point from ether that you should remember is, okay, the Goodell's. Okay, Goodell's ने दूसरा क्या दिया था anesthesia में? That was the Goodell's oropharyngeal airway. Okay, oropharyngeal airway. So Goodell's was the one who described the 4 stages of anesthesia, and these 4 stages, remember, are, okay, these 4 stages are only true with ether. That is also very important. These 4 stages of anesthesia are only true with ether. The stage 1 is the stage of analgesia. Okay, and that is from the beginning of the anesthetic inhalation till the loss of consciousness. That is stage 1. Okay, what is stage 2? That is stage of delirium or excitement. Okay, from kahan se? Loss of consciousness till the beginning of regular respiration. And remember, in the stage 2 there is roving of the eyeball, pupil is partially dilated. These are the questions which are asked. An important question which is asked is the eyelash reflex, or the first reflex to be lost is the eyelash reflex. And remember, I am repeating this point, the Goodell's, okay, stages of anesthesia, it is true only with ether. It is true only with ether. Now, what is stage 3? Stage 3 is very important. It is very important. Why? Because it is the stage of surgical anesthesia. Okay, the stage in which the surgery is performed is stage 3, and that is from the regular respiration till the cessation of spontaneous respiration. Now the stage 3 is further divided into 4 planes, and it is the stage 3, plane 3, in which the surgery is done. So please remember that point also. And stage 4, we should not achieve the stage 4 because stage 4 is medullary paralysis. Is it clear? So Goodell tha, he described 4 stages of anesthesia, and these stages are true only and only with ether. Okay, as I mentioned earlier, the stage 3, plane 3 is the one which is appropriate for the surgery, and if someone asks, the first reflex to be lost is the eyelash reflex, and that is in stage 2. Okay, and remember, it is not W.T.J. Morton who is father of anesthesia, it is John Snow. Okay, who also discovered chloroform. John Snow is the one who is father of anesthesia. And August Bayer, okay, August Bayer was the one who was the one for the first panel anesthesia. Okay, so first panel anesthesia, August Bayer. He also introduced intravenous regional anesthesia. Okay, IVRA, that is intravenous regional anesthesia. Okay, and therefore intravenous regional anesthesia is also known as Bayer's block because it was introduced by August Bayer. So August Bayer ने भी दो चीजें दी थी, that is the spinal anesthesia and IVRA. Is it clear? Is it clear? Now coming to the next very important topic, that was the history point of view. Now coming to the pre-anesthetic checkup. The first question is, why the pre-anesthetic checkup done? What do we mean by pre-anesthetic checkup? Before giving anesthesia, we are checking up the patient, right? So what is the primary goal? What is the primary goal for the pre-anesthetic checkup? That is the risk stratification of the patient. Okay. So the primary goal for the risk stratification for the pre-anesthetic checkup is risk stratification of the patient undergoing surgery, so that with the aim of controlling and reducing the risk related to the anesthesia and surgery. So that is why the risk stratification is done. Okay. Now, I'm so sorry, my image is coming, that's why it won't be clear to you. Let me just set it. Okay, now in the pre-anesthetic checkup, what are the steps which is done? So the first step which is done in the pre-anesthetic checkup is we take the history. We take the history of any acute illness, the chronic illness, if the patient is on any medications. Okay, if any previous surgical procedures were done. So all these things are covered in the history point of view. Why the history is very important? Because if the patient is suffering from any comorbidities, then accordingly we have to plan our anesthesia and procedure, and also we have to plan when to take the patient and how to optimize the patient before the surgery. So this is the importance of the history. So in the history, first is the acute illness, and all of you know the commonest comorbid illness is upper respiratory tract infection, right? So the commonest comorbid illness is upper respiratory tract infection, and if that is present, we have to postpone the surgery for 6 weeks. Okay, we have to postpone the elective surgery, remember, by 6 weeks. And if the patient has to take the treatment, if the patient is already on treatment, कभी वो बोले कि डॉक्टर साहब मैं तो already cough and cold के लिए treatment ले रहा हूँ since 1 week, then we should wait for another 5 weeks. Okay, another 5 weeks, and then only we should take the patient for surgery. Is it clear? Any doubts in this? So this is the history, that is the upper respiratory tract infection. And another thing, for 6 weeks, अगर patient smoker है, if the patient is a smoker, we should delay the elective surgery for 6 weeks. Okay, he or she should stop smoking. Okay, stop smoking for at least 6 weeks before the surgery. So these are the 2 points related to 6 weeks, that is the upper respiratory tract infection and smoking. Now chronic illness. ओके, क्रॉनिक इलनेस में सबसे पहले हम लोग बात करेंगे हाइपरटेंशन. इज हाइपरटेंशन एन इंडिकेशन? Okay, is hypertension an indication to postpone a surgery? Remember, hypertension. Okay, hypertension, it is not an indication. Please remember this. Hypertension, it is not an indication to postpone any surgery. I don't know what is happening today. My image is coming. Okay, just okay. So the chronic illness में hypertension is not an indication to postpone any surgery. What if the patient is taking any drugs? What we have to do in hypertensive patient, we just have to optimize the patient. Okay, optimize the patient before the surgery, but it is not an indication to postpone the surgery. Remember. Now, the drugs, like if the patient is on the ACE inhibitors, remember, if the patient is on the ACE inhibitors, we need not stop the ACE inhibitors. ACE inhibitors can be continued till the morning of surgery. Okay, it can be continued till the morning of surgery, but if the patient is on the angiotensin receptor blockers, then it should be stopped a day before the surgery. Okay, so ACE inhibitors, no need to stop. ARBs should be stopped a day before the surgery. Diuretics, omit the morning dose, okay, of the surgery. Omit the morning dose of the diuretics. Now, very important point, what about beta blockers? What about beta blockers? Remember, if the patient is already on beta blocker, okay, if the patient is already on beta blocker, continue with the beta blocker. It should not be stopped. But if the patient is not on beta blocker, okay, if the patient is not on beta blocker, never start the beta blocker on the day of surgery. If at all you want to start the beta blocker, if in the pre-anesthetic checkup you think that there is need to start beta blocker, start at least 7 days before surgery. Okay, start at least 7 days before the surgery, but never start beta blocker on the day of surgery. That is very important point. So this is according for the hypertension. Now, what if the patient is having diabetes mellitus? Okay, so diabetes also, the sugar level should be controlled well before the surgery, and the target for the surgical patient is the sugar range should be 140 to 180 milligrams per deciliter. Is it clear? So the sugar level should be controlled well before the surgery, and the target is 140 to 180 milligram per deciliter for the surgical patient. Dr. Suhani, good evening. Welcome to the class. If any doubts, please let me know. This is just the revision. Okay, I have already covered these topics previously. So that's why I'm going fast. If you think that you're not able to understand at any point, please let me know. Okay, so the diabetes control before the surgery, this is the range, that is 140 to 180 milligram per deciliter. Now, what if the patient is on oral hypoglycemic agent? Okay, if the patient is on the oral hypoglycemic agent, and if the patient is undergoing minor surgery मतलब जैसे 30 minutes की duration की है, blood loss, okay, anticipated blood loss is very minimal, or if the patient is on OHA, minor surgery, and if it is a well controlled diabetes, ठीक है, तो हम लोग सारे के सारे oral hypoglycemic agents 24 hours before the surgery we can stop, but that is only for the minor surgery and well controlled surgery. Except, remember, this kind of question can be asked, except metformin, it should be stopped 48 hours before the surgery. Okay, so minor surgery, well controlled diabetes में 24 hours, except metformin, that is 48 hours before the surgery. Now what about major surgery जिसका ड्यूरेशन मोर देन 30 minutes है, anticipated blood loss is high, then even if the patient is on the OHA, even if it is well controlled, remember, for the major surgery, replace it with insulin. Okay, replace it with insulin when? At least 5 days before the surgery. Okay, and throughout the surgery continue this insulin as per the sliding regime. This is for the diabetes. If the patient is already on insulin, then also depending upon the morning blood sugar level, you should continue the insulin intraoperatively as per the sliding scale. So this is done for diabetes. Now pre-operatively, before the procedure, the blood sugar, this is also asked. Pre-operatively, blood sugar should be checked every 4th hourly, and intraoperatively it should be checked every 1 hourly. Okay, so pre-operatively it is 4th hourly, intraoperatively 1 hourly, and give insulin according to the sliding regime. Okay, now what if the patient is giving history of MI, myocardial infarction? ठीक है, अगर पेशेंट MI की हिस्ट्री दे रहा है, then the elective, remember, elective non cardiac surgery, ठीक है, elective non cardiac surgery should be delayed at least 60 days, ठीक है, after the MI, if no coronary intervention was done. अगर उसका PCI, बलून एंजियोप्लास्टी, बाईपास वगैरह कुछ नहीं हुआ था, सिर्फ उसकी हिस्ट्री ऑफ MI है, then the elective non-cardiac surgery should be delayed by at least 60 days. Remember this. Maga, what if the intervention was done? Okay, now depending upon the intervention, अगर सिर्फ बलून एंजियोप्लास्टी हुई थी, okay, to open up the vessel, if balloon angioplasty was done, then wait for at least 14 days. Okay, remember this, wait for at least 14 days. What if the stent was placed? Okay, what if the stent was placed? Remember, bare metallic stent, ठीक है, bare metallic stent के लिए सिर्फ तुम्हें 1 month, that is 30 days, you have to wait for the elective non-cardiac surgery. But if it is a drug-eluting stent, इसमें 2 क्वेश्चन पूछे जाते हैं. एक, what is the drug used? That is sirolimus. And how much time we should wait? That is for 1 year. Is it clear, Dr. Sohani? Any doubts till now? Okay, so myocardial infarction, elective non-cardiac surgery, delayed by 60 days in the absence of any coronary intervention. If the intervention is done, that is balloon angioplasty 2 weeks, bare metallic stent 1 month, and if it is a drug-eluting stent, then at least 1 year. These are the questions which are frequently asked. Now, coming to the last part of the history in pre-anesthetic checkup, history of medications, history of any medications. So in that, what if the patient is on antiplatelet drugs? What if the patient is on antiplatelet drugs? If the patient, remember, on the low dose aspirin, if the patient is on low dose aspirin, then it need not be stopped before the surgery. Remember, if the patient is on low dose aspirin like 150 mg or 75 mg of aspirin, then it need not be stopped before the surgery. Remember, clopidogrel, okay, clopidogrel, it should be stopped 5 to 7 days, preferably 7 days before the surgery. Okay, aspirin low dose need not be stopped. Clopidogrel 5 to 7 days, ticlopidine at least 10 to 14 days before the surgery. Please revise this table a day before the exam also. This is very important table. ठीक है, तो एंटीप्लेटलेट्स में एस्पिरिन, क्लोपिडोग्रेल एंड टिक्लोपिडिन. Anticoagulants, warfarin, very frequently asked. Warfarin 5 days before the surgery. What about low molecular weight heparin? Okay? Low molecular weight heparin only 24 hours before the surgery it has to be stopped. Okay? What about, so these are the anticoagulants, antiplatelets. Now what about OCPs? Oral contraceptive pills. If the patient is on estrogen, there are chances of thrombosis, right? So therefore estrogen, it should be stopped 4 weeks before the surgery. Remember, estrogen, it should be stopped 4 weeks before the surgery, but we need not stop progesterone. Progesterone need not be stopped before the surgery. If the patient is on mixed OCP, that is estrogen and progesterone, तो क्या करेंगे? Because it is having estrogen, it should be stopped 4 weeks before the surgery. Are you getting my point? Okay. So aspirin need not be stopped. Clopidogrel 5 to 7, ticlopidine 10 to 14, warfarin 5 days, low molecular weight heparin for 24 hours. And what about MAO inhibitors? MAO, कितने letters है? 3 letter. 3 letters are there in MAO. Okay, I think it is not very clear. Okay, just a second. Okay, so the MAO inhibitors, कितने letters है? 3 letters है, right? So MAO should be stopped 3 weeks. Remember, it should be stopped 3 weeks before the surgery. Lithium, 2 letters, lithium. It should be stopped 2 days before the surgery. Is it clear? Is it clear? So MAO is 3 weeks, lithium is 2 days. What about the herbal preparations, ginger, garlic? ठीक है, ये coagulation में interfere करते हैं, therefore they should be stopped 2 weeks before the surgery. ठीक है, so please revise this table just before the exams. This is very important table. Now that was the history part. Now हिस्ट्री के बाद हम लोग पेशेंट को एग्जामिन करेंगे कि उसको कोई सिस्टमिक इलनेस या फिर जनरल फिजिकल एग्जामिनेशन में पैलर इक्ट्रस वगैरह क्लबिंग तो नहीं है, ठीक है. बट द मेन थिंग वी फोकस ऑन, एंड फॉर टुडेज लेक्चर विल बी फोकसिंग ऑन द एयरवे एग्जामिनेशन. ओके, वन सेकेंड. So because the airway, okay, the airway, it is the sole purpose of the anesthesiologist to make sure that the airway is proper. ठीक है, therefore airway examination. तो airway examination में क्यों एयरवे एग्जामिनेशन करने की, हम उसको बैग मास वेंटिलेट ठीक से कर पाएंगे कि नहीं, हम उसको इंट्यूबेट लैरिंगोस्कोपी उसको भी कर पाएंगे कि नहीं. देयरफॉर एयरवे एग्जामिनेशन इज वेरी इंपॉर्टेंट. सबसे पहले एग्जामिनेशन ऑफ द टेम्पोरोमैंडिबुलर जॉइंट. ठीक है, सबसे पहले असेस द टेम्पोरोमैंडिबुलर जॉइंट फंक्शन इन द एयरवे एग्जामिनेशन. इसमें सबसे पहले इम्पॉर्टेंट, वेरी इम्पॉर्टेंट, द इंटर इंसाइजर गैप. कितनी उसकी माउथ ओपनिंग है. माउथ ओपनिंग कैसे देखते हैं? इंटर इंसाइजर गैप, दो सेंट्रल इंसाइजर्स में कितना डिस्टेंस है. दैट शुड बी मोर देन 3 हॉरिजॉन्टल फिंगर्स. रिमेंबर, ऑफ द पेशेंट. ठीक है, सो एयरवे एग्जामिनेशन में असेस द टेम्पोरोमैंडिबुलर जॉइंट फंक्शन, दैट इज mouth opening, the interincisor gap, it should be more than 3 horizontal fingers of the patient. The patient should be able to protrude the jaw and upper lip bite test. upper lip bite test में क्या होता है? अगर हम लोग नॉर्मल, जहाँ पे TMJ फंक्शन नॉर्मल है, ठीक है, उसको जब अपना अपर लिप बाइट करने की कोशिश करेगा तो वी विल बी एबल टू टच द वर्मिलियन लाइन. If the patient is able to touch the vermilion line, that means the TMJ function is fine. Remember, in TMJ, the mouth opening, should be more than 3 horizontal finger of the patient. Then, असेसमेंट ऑफ सेकेंड थिंग हम लोग देखते हैं कि मैंडिबुलर स्पेस या फिर फ्लोर ऑफ माउथ फॉर टंग। जब हम लोग लैरिंगोस्कोपी करते हैं तो टंग को डिस्प्लेस करना है, तो हमारे पास सफिशिएंट डिस्टेंस है कि नहीं। तो उसमें हम तीन चीजें देखते हैं, एक तो थायरो, ठीक है, थायरो मेंटल डिस्टेंस, थायराइड कार्टिलेज से मेंटल तक, थायरो हायोइड डिस्टेंस एंड हायो हायोइड डिस्टेंस। डॉक्टर सुहानी, इज इट क्लियर? ठीक है, if I'm too fast, please let me know. Others also, if any doubt, please let me know. Okay, so I'm telling about the other examination that should be done. पहले तो mouth opening सही होनी चाहिए, then you have to see the distances, that is thyromental. I'll just show you the figure. Okay, this is the mouth opening. This is the mouth opening. Then you should see about the thyromental and thyrohyoid distance. Okay, and thyromental distance. So thyromental distance, normally it is four fingers. Thyomental, okay, that is 3 fingers, and thyrohyoid is 2 fingers. Remember the 3-3-2 rule. Remember the 3-3-2 rule. That is the adequate mouth opening, that is interincisor gap, that is three fingers. Okay, hyomental between the hyoid bone and the pubic symphysis, not the pubic symphysis, I'm sorry, hyoid bone and symphysis mentae, it should be 3 fingers, and thyrohyoid, it should be 2 fingers. So this is the normal 3-3-2 rule. ठीक है, 3-3-2 rule में hyomental, thyrohyoid and interincisor gap is there. Now another important thing is examination of oropharynx. ठीक है, सीधा सीधा ये क्वेश्चन आ सकता है, adequacy of oropharynx. ठीक है, कि ओरोफैरिंक्स में कुछ प्रॉब्लम तो नहीं है फॉर लैरिंगोस्कोपी एंड इंट्यूबेशन, दैट इज डन बाय मलमपट्टी क्लासिफिकेशन. ठीक है, सो मलमपट्टी क्लासिफिकेशन, वेरी इंपॉर्टेंट क्लासिफिकेशन. दिस इज डन फॉर एडिक्वेसी ऑफ द ओरोफैरिंक्स फॉर द लैरिंगोस्कोपी एंड इंट्यूबेशन. ठीक है, and this why modified, it was modified by Samson and Young. They were the one who added grade 4, okay, in Malampati classification. So Malampati classification, if someone asks, it is for the adequacy of the oropharynx for intubation and laryngoscopy. Now इसको कैसे करते हैं, एग्जामिनर, ठीक है, एग्जामिनर पेशेंट के जस्ट अपोजिट बैठेगा. रिमेंबर द टू इम्पॉर्टेंट थिंग्स यू हैव टू रिमेंबर इज द पेशेंट माउथ शुड बी वाइड, tongue should be protruding out and without phonation. Please remember these points, these can be asked. ठीक है, तो मलम पट्टी कैसे करते हैं, पेशेंट के सामने एग्जामिनर बैठता है, उसको बोलता है अपना पूरा मुंह खोलो, ठीक है, टंग को बाहर निकालो विदाउट फोनेटिंग. रिमेंबर इट शुड बी विदाउट फोनेटिंग. ठीक है, देन द मलम पट्टी स्कोर डिपेंडिंग अपॉन द स्ट्रक्चर्स विच आर सीन. So normally there are 4 structures seen. Okay, normally there are 4 structures seen. These are the anterior pillars. Okay, these are the anterior pillars, the uvula, the soft palate, okay, the soft palate and the hard palate. So these are the 4 structures seen. Remember the mnemonic push, that is the pillars, uvula, soft palate and hard palate. If all these 4 structures are seen, then it is class 1 and it is simple intubation. Okay, the oropharynx is adequate. What happens if I'm not able to see the pillars as seen here? If the pillars nahi dikh rahe, sirf uvula dikh raha hai, soft palate and hard palate is seen. So when the pillars, the P is not seen, then that is class 2. ठीक है, पुश में से P चला गया. What if even the uvula is not seen? Uvula भी नहीं दिख रहा, सिर्फ soft palate and hard palate दिख रहा है. Then that is class 3. Okay. What happens in class 4? Only hard palate is seen. None other structures are seen. So that is class 4 and class 3 and 4. If that is seen, that means there might be difficulty in laryngoscopy and intubation. Is it clear? So remember the mnemonic push. Okay. Now, this is adequacy of the oropharynx bedside. ठीक है, अब on the table when we have done the intubation, ठीक है, so when we have done the laryngoscopy, ठीक है, तो laryngoscopy में क्या क्या structures दिख रहे हैं उसके हिसाब से assessment of intubation on the table, and that is Cormack-Lahane, and Lahane classification, ठीक है। बेड साइड पे ओरोफैरिंग्स का देखने के लिए मलम पट्टी हो रहा था, जब लैरिंगोस्कोपी कर दिया उसमें क्या क्या स्ट्रक्चर्स दिख रहे हैं, एंड इफ द इंट्यूबेशन विल बी डिफिकल्ट और नॉट, फॉर दैट वी आर डूइंग कॉर्मिक एंड लहाने क्लासिफिकेशन। तो लैरिंगोस्कोपी करने के बाद इफ आई एम सीइंग द वोकल कॉर्ड्स, the leaf-like structure, that is epiglottis, and the erythenoids, then that is grade 1. ठीक है, if epiglottis, vocal cords and erythenoids all are seen, then that is grade 1. Now the grade 2, ठीक है, grade 2 is grade 2A and grade 2B. ये जो हम लोग अभी देख रहे हैं, ठीक है, more than 50% of the glottic structures, like we are able to see the vocal cords more than 50%, we are able to see the erythenoids, and we are able to see the epiglottis, then it is grade 2A. If I'm seeing only the posterior 1/3 of glottic structures, or if I'm able to see, ठीक है, only posterior or less than 50% of the glottic structure plus epiglottis, then it is grade 2B. ठीक है, what happens in grade 3? Grade 3 में I'm able to see only epiglottis, ठीक है, only epiglottis is seen in Cormack-Lahane grade 3. In grade 4, I am not able to see any epiglottis, nor I am able to see any glottic structures. So, depending upon the laryngoscopic view, ठीक है, assessment of intubation on the table grade 1, 2, 3 and 4, and 2 is further divided into 2A and 2B. Now, grade 1 and 2A, it is normal intubation. For 2B, you require stellate guided intubation. 3 and 4 comes under difficult intubation. 3 and 4 comes under difficult intubation. Is it clear? So, this is the Cormack-Lahane classification. Now, assessment of the cervico-occipital atlanto-occipital joint. ठीक है, इसका मतलब है कि उसके क्या नेक मूवमेंट्स, ओके, नेक मूवमेंट सही है कि नहीं, सो दैट वी कैन हैव अ प्रॉपर पोजीशनिंग, दैट इज द स्निफिंग पोजीशन इन लैरिंगोस्कोपी. सो असेसमेंट ऑफ स्निफिंग पोजीशन, ठीक है, स्निफिंग पोजीशन ऑफ लैरिंगोस्कोपी, इंपॉर्टेंट क्वेश्चन, ठीक है, इसमें क्या चाहिए स्निफिंग पोजीशन में? Sniffing position में we need, remember, extension at atlanto-occipital joint, ठीक है, and flexion at cervical joint. Please remember what is sniffing position. All the vowels E, A, O are coming together, ठीक है, तो extension at atlanto-occipital joint and flexion at cervical joint, we will get the sniffing position, which is optimal position for laryngoscopy, because the oropharyngeal laryngeal axis come in the favorable side. ठीक है. Now, another important question which is asked in exams are, how do we predict the difficulty in bag mask ventilation? How can we predict the difficulty in bag mask ventilation? Is it clear? Any doubts till now? Any doubts till now? Okay. So the predictors for the difficulty in bag mask ventilation, ठीक है, bag mask, B से, okay, you will remember acronym OBs, ठीक है, you will remember OBs. So if the patient is obese, that is BMI is more than 30 kg per meter square, इसका neck क्या होगा, short होगा, and mostly will be having difficulty in positioning of the patient if the beard is there. ठीक है, अगर patient को beard है, then to form the tight seal therefore will be difficult, and therefore it will be difficult for us to bag mask the patient. ठीक है, so predictors of difficult is obese, O से obese, B से beard, E से elderly. elderly में there is no pad of fat. ठीक है, या फिर उनको रूमेटॉइड आर्थराइटिस होगा जिसकी वजह से उनके नेक मूवमेंट्स नॉर्मल नहीं होंगे, एंड देयरफॉर इट विल बी डिफिकल्ट फॉर बैग मास्क वेंटिलेशन. स्लीप एपनिया, स्लीप एपनिया में क्या होगा, टंग फॉल. Okay, it will be difficult for us to maintain the patency, and edentulous patient, pad of fat is not there, therefore formation of the tight seal will be difficult. So these are all the predictors of difficult bag mask ventilation. So remember obese. ठीक है, for bag mask ventilation remember obese. ठीक है, now laryngoscopy and endoscopy. ठीक है, predictors for difficult laryngoscopy and endoscopy remember lemon. ठीक है, so L से remember lemon. ठीक है, so predictors for difficult laryngoscopy and endoscopy, first of all look. क्या देखोगे, क्या देखोगे, if there is any anatomical abnormality, large tongue तो नहीं है, short neck तो नहीं है, buck teeth तो नहीं है. Evaluate 3-3-2 rule. क्या था 3-3-2 rule? That was adequate mouth opening है कि नहीं, 3 horizontal fingers जा रहे कि नहीं, hyo mental distance and thyrohyoid distance. ठीक है, Malampatti classification. What is the grade of Malampatti? Obstruction. Is there any obstruction present? Are there any oropharyngeal masses? Are there any adenomas? And how are the neck movements? ठीक है, if the patient is able to flex or extend the neck properly or not. So these are the things which you should see for laryngoscopy and endoscopy. These are the predictors for difficult laryngoscopy and endoscopy. Is it clear? Is it clear? Any doubts? Anyone, any doubt? Okay, I'm a bit fast because I have to cover lots and lots of topic. This is just the rapid revision. But then also, if any doubts, please let me know. Dr. Sohani, is it clear? Okay, now coming to very important point, another point, that is difficult airway. Okay, difficult airway. What is difficult airway? Difficult airway is defined as the clinical situation. Okay, difficult airway is the clinical situation in which, okay, a conventionally trained anesthesiologist, okay, conventionally trained anesthesiologist experiences difficulty in face mask ventilation of the upper airway. मतलब एक जो anesthesiologist है who is trained enough, उसको प्रॉब्लम हो रही है बैग मास्क करने में, या फिर उसको प्रॉब्लम हो रही है इंट्यूबेशन करने में. इफ दैट इज द केस देन दैट इज नोन एज डिफिकल्ट एयरवे. If that is the case, then that is known as difficult airway. And this is how, okay, according to the DAS guidelines, that is Difficult Airway Society guidelines. Remember, Difficult Airway Society guidelines 2015, मैनेजमेंट ऑफ अनएंटिसिपेटेड डिफिकल्ट ट्रेकिल. हम लोगों ने सोचा नहीं था कि उसको ट्रेकिल इंट्यूबेशन डिफिकल्ट होगा, बट on the table there is difficulty in intubating the patient. Now what should we do? What should we do? So remember, ये जो point है, ये जो है, this is the question which is asked. फर्स्ट एंड द फॉरमोस्ट थिंग, सबसे पहले अपना क्या प्लान होता है कि पेशेंट को फेस मास्क वेंटिलेट करो और ट्रेकिल इंट्यूबेट करो. सो दैट इज प्लान ए, दैट इज द फर्स्ट प्लान. ठीक है, कोई भी पेशेंट को फेस मास्क वेंटिलेट एंड इंट्यूबेट द पेशेंट. व्हाट इफ आई एम नॉट एबल टू इंट्यूबेट द पेशेंट इवन आफ्टर three attempts? ठीक है, then the plan B should be supraglottic airway insertion. ठीक है, supraglottic airway insertion, that is plan B. So plan A is face mask ventilation, plan B is supraglottic airway insertion, plan C is अगर हम लोग सुप्राग्लॉटिक एयरवे को भी इंसर्ट नहीं कर पा रहे हैं, then we should at least be able to face mask ventilation. ठीक है, फेस मास्क वेंटिलेशन. अगर पेशेंट को हम लोग फेस मास्क वेंटिलेट भी नहीं कर पा रहे, that means we are not able to, cannot oxygenate वाली कंडीशन आ गई है. Okay, cannot intubate, cannot oxygenate. At that time, go for emergency front neck access, that is, go for tracheostomy. Okay, so these are the plans and these are the questions which is asked. Plan A is just face mask tracheal intubation. Plan B is supraglottic airway insertion. Plan C is face mask ventilation, and plan D is emergency front of neck access. Is it clear? Is it clear? Okay, now we have done the history, we have done the examination, the airway examination, then we will investigate the patient. I'm not going into detail of investigation because depending upon the patient's conditions, the comorbidities and the surgery, the investigation differs, but there are some investigations which are done for all the patients, that is the hemogram and urine microscopy. Okay, so the primary investigation screening that is done for all patients is hemogram and urine microscopy. And remember, if the age is more than 35 years, okay, if the age is more than 35 years, then chest X-ray and ECG are also included in primary investigation. ठीक है, नाउ उसके बाद ये सब हमने कर लिया, हमने क्लिनिकल हिस्ट्री ले ली, ठीक है, एयरवे एग्जामिनेशन कर लिया, इन्वेस्टिगेशन कर लिया. अब हम लोग पेशेंट को रिस्क स्ट्रैटिफाई करेंगे. ठीक है, दिस इज वेरी इंपॉर्टेंट पॉइंट. ठीक है, दिस इज वेरी इंपॉर्टेंट पॉइंट, दैट इज द रिस्क स्ट्रैटिफिकेशन ऑफ द पेशेंट. Now the risk stratification of the patient, the first question asked is based upon the physical status. ठीक है, द ASA, द अमेरिकन सोसाइटी ऑफ एनेस्थेसियोलॉजिस्ट, ठीक है, क्वेश्चन पूछते हैं कि किसके बेसिस पे, दैट इज अपॉन द फिजिकल स्टेटस ऑफ द पेशेंट. देयर आर हाउ मेनी ग्रेड्स, देयर आर, रिमेंबर, 6 grades. All these points are the questions. ठीक है, there are 6 grades according to ASA classification upon the physical status of the patient, that is ASA 1. ASA 1 है, क्या पेशेंट है? ASA 1 अच्छा खासा हट्टा कट्टा हेल्दी पेशेंट है. ठीक है, हेल्दी पेशेंट, नो, नॉन स्मोकर, ठीक है, नो और मिनिमम अल्कोहल यूज, देन ही और शी इज ASA 1. ASA 2, रिमेंबर, सबसे पहले क्वेश्चन, प्रेग्नेंट लेडीज, एनी प्रेग्नेंट लेडीज, दे बिलोंग टू ASA 2. रिमेंबर, फर्स्ट वाला हट्टा कट्टा, ASA 2 प्रेग्नेंट लेडीज, प्लस अगर किसी पेशेंट को हाइपरटेंशन है या फिर डायबिटीज है, मगर इट इज वेल कंट्रोल्ड. ठीक है, वेल कंट्रोल्ड है, कुछ उसको फंक्शनल लिमिटेशन नहीं है, वो अपना काम खुद आराम से कर पा रहा है, देन इट इज ग्रेड 3. ग्रेड 2, व्हाट हैपेंस इन ग्रेड 3? अगर किसी पेशेंट को हाइपरटेंशन है, ठीक है, या फिर डायबिटीज है, फॉर एग्जाम्पल अगर उसको डायबिटीज है एंड दिस इज अनकंट्रोल्ड डायबिटीज, ही इज हैविंग ESRD, और उसको डेली, ऑल्टरनेट डेज, वीकली डायलिसिस के लिए जाना पड़ रहा है, दैट मीन्स देयर इज फंक्शनल लिमिटेशन, राइट? तो it is moderate or severe systemic disease with some functional limitation, then that is ASA 3. So remember from the examples, 1 हट्टा कट्टा, दूसरा उसको माइल्ड सिस्टमिक डिसीज है, हाइपरटेंशन या डायबिटीज है, मगर उसके काम में कुछ फर्क नहीं पड़ रहा. तीसरे में क्या है, उसको डायबिटीज है, अनकंट्रोल्ड है, एंड स्टेज है, उसको बार बार डायलिसिस के लिए जाना पड़ रहा है, उसकी वजह से उसको फंक्शनल लिमिटेशन है, देयरफॉर इट इज ASA 3. 4 में उसको डायबिटीज है, उसके साथ उसको डायबिटिक कीटोएसिडोसिस हो गया, विच इज लाइफ थ्रेटनिंग कंडीशन, देयरफॉर इट इज 4. 5 moribund patient, 5 is moribund patient. Okay, then 6 is brain dead patient. So if you will remember the example, it will be very easy for you answer the question. And please remember, pregnant ladies, ठीक है, pregnant ladies, even if no comorbidities are present, pregnant ladies is ASA 2. Pregnant ladies and ASA 2. Now, if the procedure is emergency, ठीक है, then physical status is followed by E. ठीक है, so this is also a very important point which is asked, the risk stratification depending upon the physical status. Then अब अपन ने risk stratify कर लिया, patient को surgery के लिए लेनी है. What is the pre-operative advice? Important question. Another important question, the pre-operative advice which is given to the patient, before the procedure. So कितनी देर तक, सबसे पहले क्वेश्चन क्या होता है पेशेंट का, डॉक्टर साहब मुझे कितने बजे से खाना पीना बंद करना है, ठीक है, till what time can I have my meals, till what time can I have the water. So the pre-operative advice which is given is NPA orders, nil per order orders. Remember 2, 4, 6, 8 rules, and remember it is same for each and every age group. It is same for pregnant ladies also. Okay, it is same for pregnant ladies also. Please remember this. Okay, the NPO rules, that is 2, 4, 6, 8 rule, it is same for everyone, for each and every age group. And for the pregnant ladies, though 2 घंटे before the surgery, okay, 2 hours before the surgery, patient can have water, apple juice or the pulp free juices. ठीक है, remember 4 hours, ठीक है, breast milk, remember it is only the human milk, breast milk, that is 4 hours. If it is a non-human milk or a formula feed which is given to a baby, then it should be stopped at least 6 hours before the surgery. ठीक है, and light meal से जैसे 1 कप दूध, okay, 1 cup of milk plus 2 toast, then it comes under light meal. What about the solids and the heavy meal, the fried meal, the non-veg meal? It should be stopped at least 8 hours before the surgery. So this is the pre-operative advice. Then the patient will be very anxious, है ना, the patient will be very anxious, उसको secretions ज़्यादा हो रहे होंगे, acidity problem, vomiting problem. So because of all these things, we give pre-anesthetic medications to the patient. So what are the pre-anesthetic medications given? Is it clear? Till now, is it clear? Okay, so the pre-anesthetic medications which are given is anxiolytics. Anxiolytics are given to allay anxiety, to cause little bit of amnesia. तो इसके लिए हम लोग की पेशेंट अच्छे से सो जाए, ठीक है, therefore we are giving benzodiazepines a night before the surgery and also on the day of surgery. Analgesic, उसको पेन ना हो, tramadol, मॉर्फिन, सिक्रीशंस कम करने के लिए, बिकॉज अगर ज़्यादा सिक्रीशंस होंगे there are chances of bronchospasm, laryngospasm. Anticholinergics are given, in that either glycopyrrolate or atropine can be given. For acid, ठीक है, H2 receptor blocker और proton pump inhibitor, example ranitidine, pantoprazole, और antiemetics, ठीक है, जैसे उसको vomiting ना हो, therefore ondansetron and metoclopramide. So these are the pre-anesthetic medications which are given. Questions are asked from this also. ठीक है, pre-anesthetic medications are given for all of the following except, okay, so it is given to allay anxiety, it is given to decrease the secretions, it is given for analgesic purpose, it is given to neutralize the acid or to reduce the acid, or as an antiemetic. So this is why the pre-anesthetic medications which are given. Is it clear? So we have covered 2 very important topics, that is history and the pre-anesthetic checkup. Okay, and the last but not the least, the most important thing is always take the consent. don't forget to take the consent. Okay, don't forget to take the consent for the patient, from the patient. Okay, now in this class, I have already discussed about the history and the pre-anesthetic checkup. The other important questions which are asked is from the anesthesia equipment, and in that today I'll be discussing about anesthesia machine. ठीक है, एनेस्थीसिया मशीन से क्या क्वेश्चंस पूछे जाते हैं और ब्रीदिंग सर्किट से क्या क्वेश्चंस पूछे जाते हैं. इज इट क्लियर गाइस? एनी डाउट्स टिल नाउ? ठीक है. So coming to anesthesia machine, just a quick history point of view. ओके अगर ये एनेस्थीसिया मशीन है जो कि बाबा आलम के ज़माने की है, सो इट वाज द फर्स्ट एनेस्थीसिया, आई एम सॉरी, द फर्स्ट एनेस्थीसिया मशीन. ठीक है, इट वाज मेड बाय एडमंड गैस्किन बॉयल. ठीक है, Edmund Gaskin Boyle in 1917, and therefore it is known as Boyle's machine. It is known as Boyle's machine. So the first anesthesia machine was known as Boyle's machine. Now, अपने को क्वेश्चंस किससे पूछे जाते हैं? अपने को क्वेश्चंस पूछे जाते हैं एनेस्थीसिया मशीन में हाई प्रेशर, इंटरमीडिएट एंड लो प्रेशर सिस्टम. सी, लेट मी गिव अ वेरी ब्रीफ इंट्रोडक्शन टू दिस. एनेस्थीसिया मशीन का काम क्या होता है? एनेस्थीसिया मशीन का काम ये होता है कि उस पेशेंट को ऑक्सीजन, नाइट्रस ऑक्साइड, एयर, मतलब जितने भी एनेस्थेटिक गैसेस हैं, एनेस्थेटिक मेडिकेशंस हैं, इनहेलेशनल एनेस्थेटिक्स हैं, वो एक पर्टिकुलर प्रेशर और पर्टिकुलर कंसंट्रेशन में सेफली डिलीवर कर दें, है ना. अगर ऑक्सीजन देना है तो उसका एक प्रेशर, एक पर्टिकुलर कंसंट्रेशन में पेशेंट को सेफली डिलीवर कर दें. क्यों? क्योंकि पेशेंट खुद तो अपनी सांस ले नहीं पा रहा है. ठीक है, ही और शी इज अंडर एनेस्थीसिया, so we have to take care of everything. तो मशीन का क्या काम है कि वो एक पर्टिकुलर सेफ्टी प्रेशर और सेफ्टी कंसंट्रेशन में पेशेंट को डिजायर्ड गैसेस, ठीक है, डिलीवर कर दे. ठीक है, तो ये जो एनेस्थीसिया मशीन होती है, ओके, द न्यूमेटिक कंपोनेंट ऑफ इट, okay, the pneumatic component of the anesthesia machine is divided into the high pressure. मतलब इस पार्ट ऑफ द मशीन में जो अपना ऑक्सीजन, कार्बन या फिर जो गैसेस हैं, these will be under very high pressure and this much high pressure cannot be delivered to the patient. ठीक है, फिर वो क्या करता है एनेस्थीसिया मशीन, उसको थोड़े कम प्रेशर पे लाता है, दैट इज इंटरमीडिएट प्रेशर सिस्टम. फिर उसको लो प्रेशर पे लाता है, जिस प्रेशर पे हम लोग उस गैस को एक्चुअल में पेशेंट को डिलीवर कर सकते हैं. सो द न्यूमेटिक कंपोनेंट ऑफ द मशीन इज कन्वीनियंटली डिवाइडेड इनटू हाई प्रेशर, इंटरमीडिएट एंड लो प्रेशर सिस्टम. आर यू गेटिंग माय पॉइंट? गेटिंग माय पॉइंट? सो अब हाई प्रेशर के अंदर क्या क्या आता है? द हाई प्रेशर सर्किट, रिमेंबर, हाई प्रेशर सर्किट सिलेंडर, द मेडिकल गैस सिलेंडर जिसमें से ऑक्सीजन, कार्बन डाइऑक्साइड, एयर आता है, ठीक है, इनटू द एनेस्थीसिया मशीन. इफ इट इज कमिंग फ्रॉम द सिलेंडर्स, द मेडिकल गैस सिलेंडर्स, देन इट इज in these cylinders the anesthetic medications are under high pressure. They are under high pressure. Is it clear? Is it clear? So the cylinder, the medical gas cylinders, the yoke assembly, I'll tell you what is yoke assembly. Okay, and the first pressure reducing valve, the first pressure reducing valve, these all come under high pressure system. These all come under high pressure system. So anesthesia cylinders से क्या question आता है? First of all, it is under high pressure. हाई प्रेशर का मतलब क्या है कि इसके अंदर ऑक्सीजन, नाइट्रस, ठीक है, कार्बन डाइऑक्साइड, दीज आर प्रेजेंट अंडर हाई प्रेशर. जैसे ऑक्सीजन 2000 psi, 760 psi, ठीक है, तो these are stored in high pressure in these cylinders, so these form a part of the high pressure system. Now second question, anesthesia cylinders किसके बने हुए होते हैं? These are made up of molybdenum, please remember. But if it is as anesthesia cylinder which is MRI compatible, जो हम लोग MRI उसमें रूम में भी ले सकते हैं. Those cylinders are made up of aluminium. It is not made up of molybdenum, it is made up of aluminium. So anesthesia cylinders normally are made up of molybdenum, but if they have specified that MRI compatible, then our answer will be aluminium. Okay, then to make them lightweight, to make these anesthesia cylinders lightweight, chromium is added. So basically anesthesia cylinders are made up of molybdenum. Now depending upon the size, तुमने देखा होगा सबसे छोटे और सबसे बड़े भी होते हैं, बहुत बड़े बड़े भी होते हैं. So depending upon the sizes, the anesthesia cylinders are divided into A to H type. ठीक है, A is smallest, H is largest. और क्वेश्चन क्या पूछा जाता है एनेस्थीसिया मशीन में, जो हम लोग OT में देखते हैं. एनेस्थीसिया मशीन में द मोस्ट कॉमनली यूज टाइप इज टाइप E. ठीक है, so it is the type E which is most commonly used in anesthesia machine. So this is about the anesthesia cylinder. Is it clear? Any doubts, guys? Any doubts? Okay. ठीक है, so anesthesia cylinders made up of molybdenum, MRI compatible aluminium, made light with chromium, A to H type. Now अब जल्दी जल्दी रिवाइज करेंगे. ऑक्सीजन सिलेंडर, सी ऑल द सिलेंडर्स दे आर कलर कोडेड. ऑल द सिलेंडर्स दे आर कलर कोडेड. जैसे कि गलती से दूसरा सिलेंडर हम लोग टू प्रिवेंट द इंटरचेंजिंग ऑफ द सिलेंडर, ठीक है, क्योंकि हमें नहीं पता उसके अंदर क्या गैस है, तो देयरफॉर दे आर कलर कोडेड. सेकेंडली one of the major safety measure to prevent the incorrect attachment, okay, to prevent incorrect attachment of cylinder to anesthesia machine is pin index. So pin index, it is a safety measure. It is a safety measure which prevent incorrect attachment of the cylinder to the anesthesia machine. So jaldi oxygen cylinder color coded. Remember judge. Okay, remember judge. पुराने जमाने के जज वो क्या करते थे, व्हाइट कलर की विग पहनते थे और नीचे ब्लैक कलर का कोट पहनते थे. तो the shoulder is white in color, the body is black in color. What is the pin index? How do we write oxygen? O2. The molecular formula is O2, that means 2 and 5, that is 2 and 5. Nitrous oxide, nitrous, ठीक है, हिंदी में ब्लू को क्या बोलते हैं, नीला, N say N, so it is blue in color, and the pin index nitrous oxide 2 plus 1, it is 3,5, is it clear? Carbon dioxide C से क्या बन सकता है, G, ठीक है, बस एक डैश लगा के C से G बन सकता है. So it is gray in color, and whenever C is present, the 6 is present. ठीक है, the 6 is present, therefore it can be 1,6 or 2,6. The pin index is 1,6 or 2,6 depending upon the concentration of carbon dioxide. If the carbon dioxide is less than if it is more than 7.5%, and if it is less than 7.5%, okay, if it is more than 7.5, then it is 1,6. If it is less than 7.5%, then it is 2,6. Air, it is a mixture, right? Okay, one second. ठीक है, तो एयर क्या है, इट इज अ मिक्सचर, एयर इज अ मिक्सचर. तो इसका जो शोल्डर होगा वो क्या है, वो ब्लैक एंड व्हाइट कलर का है. मगर एयर के अंदर आजकल पॉल्यूशन की वजह से क्या बढ़ता जा रहा है, पॉल्यूशन की वजह से कार्बन डाइऑक्साइड बढ़ता जा रहा है, और कार्बन डाइऑक्साइड का कलर क्या है, ग्रे. ठीक है. The major part of it, the body is gray, the shoulder is black and white in color, and A, it is the first letter, so it is 1,5. It is 1,5. Antonox 50%, nitrous oxide 50%, oxygen, okay, 50% oxygen. So it is what, blue and white shoulder, body is blue. Remember इसका pin index सिर्फ एक है, that is 7. Cyclopropane, it is orange in color, cyclo, C से क्या आएगा, 6, right? C से क्या आएगा, 6, so it is 6. Propane, that is 3, so it is 3,6. Is it clear? So these are the different color coding and the indexes of the cylinders which is present. Now, another important point which is asked is जितने भी gases हैं, these are stored in the gaseous form, except some of the gases are present in the liquid form, that is carbon dioxide, nitrous oxide and cyclopropane. ये भी एक question पूछा जाता है, ठीक है? These are stored in liquid form in the anesthesia cylinder. Now, coming to the hanger yoke assembly, ठीक है? I hope it is clear. Okay, I hope this is clear. Now coming to the hanger yoke assembly. Hanger yoke, okay, hanger yoke, it is a point, okay, it is a point where the cylinder is attached with the anesthesia machine. Okay, जहाँ पे anesthesia machine में cylinder attach होगा, okay, it is a point where cylinder is attached to the anesthesia machine, that is the hanger yoke assembly. It orients and supports the cylinder and it provides a gas tight seal, and यहाँ पे unidirectional flow of the gas होता है, और यहाँ पे ही ये pin index होता है, ठीक है, यहाँ पे ही ये pin index होता है, ठीक है. तो pin index safety system, I told you, in order to prevent the wrong entry of gases into the anesthesia, ठीक है. तो यहाँ पे ये एक आउटलेट है जहाँ से ऑक्सीजन या नाइट्रस जो भी सिलेंडर है उसकी गैस अंदर जाएगी, और नीचे आर्क में ओपनिंग प्रेजेंट होती है. तो जौन सी ओपनिंग प्रेजेंट होगी उसके हिसाब से पिन इंडेक्स होगा. फॉर एग्जांपल ऑक्सीजन का क्या है, 2,5, so it will be second and the fifth opening which will be open. It was the second and the fifth opening which will be open. ठीक है. So these are the high pressure system. Now the intermediate pressure system. ठीक है. intermediate pressure system में जो central pipelines होती हैं, you must have seen like these pipelines in the ICU and the OTs, ठीक है. Colored pipelines होती है which is getting attached to the anesthesia machine. So if the gas supply is coming from these pipelines, it can come either from the cylinders. So cylinders get high pressure. If it is coming from these pipelines, then it is a part of the intermediate pressure system. And this was the question which is asked, which was asked. Now in INI-CET, ठीक है. तो इसमें भी color coding होती है. Remember the white, okay, the white pipeline, it is for oxygen. N से नीला, it is blue. Air is black, ठीक है, AB. Air is black and vacuum is yellow. और इस cylinder में the safety measure to prevent the long attachment of cylinder to the anesthesia machine, it was pin index. Similarly, for these pipelines, कि गलत pipeline machine से attach ना हो जाए, उसके लिए होता है diameter index safety system. Is it clear? It is diameter index safety system. Guys, is it clear? Any doubts in this? So for the cylinders, it is pin index, but for the pipelines, remember, it is diameter index safety system. And it is an intermediate pressure system, so the pressure in this is 55 to 60 psi. It's 55 to 60 psi. Now, another important component which can be asked in intermediate pressure system is oxygen flush. ठीक है. एक ऐसे ऑक्सीजन का एक बटन होता है, ठीक है, जिसमें से फ्लश में ऑक्सीजन बाहर निकलती है. Remember, it is a part of intermediate pressure system which is used mostly in emergencies. It is used mostly in emergencies also. हमेशा वो बायोट्रॉमा हो सकता है, there can be dilution of inhaled gases. So just remember, oxygen flush, it is a part of intermediate pressure. It is not a part of high pressure system. It's a part of intermediate pressure system, and the flow rate is 35 to 75 liters per minute. Okay? Now, is it clear? Any doubts? Now, another important point which is asked is oxygen pressure failure safety devices. Okay? Oxygen pressure, कभी भी anesthesia machine में oxygen का pressure कम होगा, so there are certain safety devices which will be activated. Guys, is there any lag? Okay, Dr. Suhani is telling me there is lag. Dr. Suhani, please tell me now, is it clear? Now is it clear? Now is it clear? Is there lag till now? Just give me a second. Okay, please let me know if there is any lag or if the voice is cracking. If that is so, then I'll continue after some time, or I'll continue tomorrow. Is it clear? Others, please let me know. I think there is lag. Okay. Okay. So I'm talking about the oxygen pressure failure safety devices. I was telling that if at all, okay, I think now the net is fine. Dr. Sohani, please tell me if the net is fine now, if you are able to hear me. Okay, so I was telling you oxygen pressure failure safety devices. It is not clear. Others, is it clear? Others, is it clear? Okay. Okay. Then tomorrow I'll continue. Okay, friends. Then I'll continue with it tomorrow. From tomorrow will be continuing with the intermediate pressure system only. So I'll be posting about the class. I'll be posting about the class on the Telegram app. Okay, and on this channel, that is livedaily.me or NEET PG channel. And tomorrow I'll be continuing with the anesthesia machine and the breathing circuits. Sorry, there is some problem for the from the network point of view. So okay, Dr. Sohani, is it clear? So I can, please let me know if it is clear, then I'll just continue with the topic. Okay, I think now the net is clear, so I'll just continue with the topic. So I was telling that the intermediate pressure system, okay, the intermediate pressure system, it has one more thing, that is the oxygen failure safety devices. तो ऑक्सीजन फेलियर सेफ्टी डिवाइसेस, अगर एनेस्थीसिया मशीन में ऑक्सीजन का प्रेशर कभी भी कम होता है, ठीक है, अगर ऑक्सीजन प्रेशर फॉल्स, ठीक है, देन what will happen, there are some failure safety devices so that other gases, okay, other gases are not are not delivered to the patient. So these are the oxygen supply pressure failure safety devices. Now in this we have two types, threshold safety and proportionating safety devices. Okay. Dr. Suhani, now is it clear, right? So I was telling the oxygen pressure failure safety devices, threshold safety devices and proportionating safety devices. In threshold safety devices, we have a fail-safe device or the pressure sensor shut-off device. In this what happens if the oxygen pressure, okay, if the oxygen pressure it falls below the certain level, then the other gases like nitrous oxide or air won't be, ठीक है, दूसरी gases patient तक पहुंचेगी ही नहीं to prevent the hypoxia, to prevent hypoxia. Is it clear? Is it clear? Please give me a thumbs up if I'm clear and audible and if you are able to understand what I'm talking about. ठीक है, तो आई एम टॉकिंग अबाउट द ऑक्सीजन सप्लाई प्रेशर फेलियर डिवाइसेस. इसमें क्या होता है, अगर ऑक्सीजन की कहीं से भी कमी होती है प्रेशर की, तो दूसरी गैसेस पेशेंट तक नहीं पहुंचती. तो एक तो थ्रेशोल्ड है और एक प्रोपोर्शनेटिंग है. प्रोपोर्शनेटिंग में क्या होगा कि अगर ऑक्सीजन का एक पर्टिकुलर कंसंट्रेशन कम हो जाएगा एक प्रोपोर्शन से, तो दूसरी गैसेस भी उतने ही प्रोपोर्शन से कम हो जाएगी. ठीक है, उतने ही प्रोपोर्शन से कम हो जाएगी. जस्ट रिमेंबर द ऑक्सीजन फेलियर सेफ्टी डिवाइसेस, दीज आर आल्सो अ पार्ट ऑफ द इंटरमीडिएट प्रेशर सिस्टम. तो सेंट्रल लाइंस, ऑक्सीजन फ्लश एंड द फेलियर सेफ्टी डिवाइसेस, ठीक है, दीज आर पार्ट ऑफ द इंटरमीडिएट प्रेशर सिस्टम. नाउ there is one more thing, that is the low oxygen pressure alarm. लो ऑक्सीजन, जब भी ऑक्सीजन का कंसंट्रेशन कम होता है, प्रेशर कम होता है, तो एक अलार्म एक्टिवेट हो जाता है. तो रिमेंबर 2 पॉइंट्स किस पे, दैट इज एट 30 psi. At 30 psi, when the oxygen pressure is less than 30 psi, then within 5 seconds an alarm will go off, and that is low oxygen pressure alarm. Is it clear? Dr. Suhani, is it clear? Okay. Now the flow control knobs. Flow control, किसका flow control करे? They are controlling the flow of the gases. अभी तक क्या था, अभी तक हम लोग प्रेशर की बात कर रहे थे, अब हम लोग बात कर रहे हैं द फ्लो. ठीक है, कितना लीटर पर मिनट, हाउ मच लीटर पर मिनट is delivered to the patient. So these are by the flow control knobs. And remember, till the flow control knobs, it is the low pressure system. Okay, till the flow control knobs, it is the low pressure system, and these flow control knobs, they regulate the flow of oxygen, nitrous oxide and other gases to these flow indicators, and ये भी कलर कोडेड होते हैं. ऑक्सीजन का वाइट, नाइट्रस ऑक्साइड का ब्लू, एयर का ब्लैक. ठीक है, एंड इवन ऑन द टच, ठीक है, इवन ऑन द टच दे आर डिफरेंट. जैसे इसमें ऑक्सीजन के में सरेशंस बड़े बड़े होते हैं, ठीक है, और नाइट्रस और एयर के सरेशंस क्या होते हैं, बहुत पतले पतले होते हैं. सो these help us, okay, these help us whenever, if we are not able to, देख नहीं पा रहे हैं, we are just feeling it, so that through the feel also we'll come to know that these are the flow control knobs for the oxygen or what. Okay, so these are also color coded and these are also different on touch. Okay, now so intermediate pressure system is central pipes. Okay, and the oxygen flush, the oxygen failure safety devices and the flow control knobs. Remember, till flow control knobs it is intermediate pressure system. इसके बाद ये जो पूरा system है, this is the flow meters or the rotameters. These are a part of low pressure system. So these are the parts of intermediate pressure system, but these are the part of low pressure system. Please remember this. Please remember this. सो लो प्रेशर सिस्टम, ठीक है, दीज आर डाउनस्ट्रीम. डाउनस्ट्रीम का मतलब क्या हो गया? टूवर्ड्स द पेशेंट. ठीक है, डाउनस्ट्रीम का मतलब क्या हो गया? टूवर्ड्स द पेशेंट. So downstream to the flow control valve, we have rotameter, the vaporizing mounting device, and the common gas outlet. Now ये जो फ्लो मीटर्स हैं, इसके ऊपर भी काफी क्वेश्चन पूछे जाते हैं. ठीक है, द मैकेनिकल फ्लो मीटर, ये जो फ्लो मीटर है मैकेनिकल इज नोन एज रोटामीटर. ठीक है, रोटामीटर के फर्दर पार्ट्स होते हैं. एक तो इसमें होते हैं थॉप्स ट्यूब. ये जो ग्लास ट्यूब होती है ना, इसके ऊपर क्वेश्चन पूछा जाता है. ये ग्लास ट्यूब इज नोन एज द थॉप्स ट्यूब विच इज टेपर्ड. ठीक है, इसके अंदर ये जो रेड कलर का मार्क होता है, दैट इज बॉबिन और मेजरमेंट स्केल. सो द एनेस्थीसिया फ्लो मीटर, ठीक है, इट कंसिस्ट ऑफ 3 parts. That is a glass tube, that is the Thorpe's tube, a bobbin and a marker. ठीक है, अब इसका प्रिंसिपल पूछा जाता है. रोटामीटर वर्क्स ऑन द प्रिंसिपल. Thorpe's tube क्या है? It is a funnel shaped tube. So there is variable area. The area is variable, but the pressure is same. ठीक है, so remember it functions on variable area and constant pressure principle. ठीक है, that is the function of the that is how the rotameter works. ये सारे questions हैं. ठीक है, now I told you flow meter जो ट्यूब है, they are funnel shape. ठीक है, now ये जो ट्यूब्स होती है ना, these are different for different gases. Like for oxygen, Thorpe's tube will be different. For nitrous oxide, Thorpe's tube will be different. Why? Because the density and the viscosity of the gases is different. ठीक है, the density and the viscosity of the gas is different. है ना, of gas is different. Therefore, ये जो Thorpe's tube होती है, तो ये flow meters होते हैं, these are different for different gases. Please remember this. ठीक है, with longer and narrower construction. नीचे की तरफ जहाँ पे narrower construction होते हैं, flow कैसा दिख रहा है? It is laminar and depends upon the viscosity of the gas, and as the viscosity of oxygen is different from nitrous, therefore the tubes are different. ठीक है, तो नीचे की तरफ it is upon the viscosity, that is lower end laminar flow, it depends upon the viscosity, and higher end, ठीक है, high flows HD, ठीक है, high definition, that is high flows depending upon the density of the gas. Is it clear? So this is about the Thorpe's tube and the rotameter. Other question that is asked is about the arrangement. Okay, it is about the arrangement. How these tubes are arranged. ये तो बता दिया, अलग अलग ट्यूब्स होती है हर एक टाइप की. Now how these tubes are present, arranged. मैंने क्या बताया था, एनेस्थीसिया मशीन का काम क्या होता है? टू प्रिवेंट हाइपोक्सिया. ठीक है, ऑक्सीजन जो है वो सही अमाउंट में पेशेंट तक पहुंचना चाहिए. नाउ द फ्लो मीटर ट्यूब अरेंजमेंट इज सच दैट ऑक्सीजन इज, ठीक है, ऑक्सीजन का जो है इट इज ऑलवेज डाउनस्ट्रीम. Oxygen is always downstream. What do we mean by downstream? That is towards the patient. ठीक है, देखो, ठीक है, जैसे अब ऑक्सीजन, ठीक है, it should be towards the patient. ठीक है, this is upstream, that is it is away from the patient. This is downstream. अब क्या होगा अगर बाई चांस, फॉर एग्जाम्पल, नाइट्रस ऑक्साइड इज डाउनस्ट्रीम. ठीक है, एंड ऑक्सीजन इज अपस्ट्रीम. व्हाट विल हैपन, अगर कोई भी थॉप्स ट्यूब में, ठीक है, लीकेज है, तो क्या होगा, पेशेंट तक नाइट्रस ऑक्साइड तो अच्छे से पहुंच रही है, ऑक्सीजन कम पहुंच रही है, देयर आर चांसेस ऑफ हाइपोक्सिया. ठीक है, ऑक्सीजन इज डाउनस्ट्रीम टू नाइट्रस, अपस्ट्रीम टू एयर, सॉरी, अपस्ट्रीम टू नाइट्रस, डाउनस्ट्रीम टू एयर. तभी भी क्या होगा, अगर यहाँ पे कुछ भी प्रॉब्लम हुई थॉप्स ट्यूब में, तो पेशेंट तक नाइट्रस आराम से पहुंच रहे हैं मगर ऑक्सीजन कम पहुंच रहे, देयर आर चांसेस ऑफ हाइपोक्सिया. So to prevent this, oxygen is always downstream. Even if there is a breakage here or breakage in this tube, क्या होगा, पेशेंट को ऑक्सीजन पूरा मिल रहा होगा. ठीक है, so there are no chances of hypoxia. Therefore, oxygen should always be downstream, that is towards the patient, than nitrous oxide and air. Is it clear? Is it clear? So oxygen is always downstream. Please remember this point. It is the oxygen flow meter is towards the patient. It is towards the patient, and it is the safety measure to prevent hypoxic flow of patient the gases. ठीक है, अब क्या हो रहा था, फ्लो मीटर से पहले गैसेस वर फ्लोइंग सेपरेटली, फ्लो मीटर्स के बाद क्या हो रहा है, ये सीरीज में प्रेजेंट होते हैं. ओके, रिमेंबर वन मोर पॉइंट, फ्लो मीटर्स are present in series. These are present in series. तो जब ये फ्लो मीटर से होते हैं, गुजरते हैं, ओके, देयर इज मिक्सिंग ऑफ द गैस. ठीक है, देयर इज मिक्सिंग ऑफ द गैस. ठीक है, सो flow meters are present in series. After passing through this, there is mixing of the gas. ठीक है, फिर क्या होगा, they will go through the vaporizer. They will go through a vaporizer. जौन सा भी vaporizer open है, फिर वो इंस्पिरेटरी लिम्ब में जाएगा. इट विल गो थ्रू द इंस्पिरेटरी वॉल्व, यूनिडायरेक्शनल वॉल्व. पेशेंट विल इनहेल, ठीक है, एक्सहेल द कार्बन डाइऑक्साइड एंड द वोलेटाइल एनेस्थेटिक्स. द रिमेनिंग इट विल, ठीक है, इट विल गो थ्रू द यूनिडायरेक्शनल वॉल्व, एक्सहेल वॉल्व. देन क्या होगा, देन इट विल गो थ्रू the carbon dioxide absorber, that is the soda line. Then it will go through the carbon dioxide absorber, that is soda line. Carbon dioxide absorb हो जाएगी and the remaining gases will enter once more into the anesthesia machine. So this is how it happens. Is it clear? Any doubts in this? Any doubts in this? Guys, I think that will be all for today's class. Okay. Tomorrow I'll continue with the breathing circuits, because that is also an important topic and I don't want to rush with you people. Okay, so today we have discussed about the history, the pre-anesthetic checkup and the anesthesia machine. The breathing circuits I'll be taking tomorrow, and we on the Telegram app. Okay, on the Telegram app we have a channel, livedaily.me on NEET PG. In this we are daily posting when will be the classes held, and tomorrow same time 7 p.m. we will continue with the revision. Okay, we will continue with the revision for FMGE exams, the important points that you must know in anesthesia. Okay, and about the Unacademy Plus subscription, I told you earlier what are the advantages. Now how to get the Plus subscription, please install. First step is install the Unacademy learning app. Okay, please install it. Then select the NEET PG, because you have to apply for NEET PG, and get the Plus subscription. Get the Plus subscription, and that subscription you can get for 12 months or 24 months. Okay, and if you apply my code, that is Apoorva Live. Okay, Apoorva Live, apply this and you will get 10% discount on these above courses. Okay, so tomorrow Dr. Sohani and others, tomorrow will be discussing about the remaining topic, that is breathing circuit. Is it okay? Is it clear? Okay, and on the YouTube we have a channel